Hi, everyone. Good afternoon. This is County Executive Pat Ryan. Hope you're doing well. We've had yet another snowstorm behind us, yet another day of shoveling the driveway late last night, as many of us did. So glad we made it through, and appreciate once again our public works team, our road crews, and all those across the county and the region doing that work to keep us safe, keep our roads going, and keep everything open. So thank you, as always, to each of you. Thank you to everybody for joining. This should be a pretty quick update. I'm going to talk about the COVID situation, our vaccination progress, and then also give you a preview of our vaccine town hall that we're going to be hosting on Thursday evening with Radio Kingston and some of our leading members of our vaccine coalition. Diving right in at the high level where we're at, we're very encouraged to see a continued decline in overall COVID infection rates and metrics. And we are seeing an increase, albeit much slower than we'd like, in our vaccination rates, in our vaccine allocation this week, which I'll talk about in a moment. So both of those dynamics are heading at least in the right direction, with COVID on the decline and vaccines on the increase. All that being said, I know the number one challenge right now is we don't have nearly enough vaccine supply for the tens of thousands of folks that are eligible in the county. And I'll talk a little bit more about what we're doing there, but please know I and we are doing everything we can, including last week sending a letter directly to Governor Cuomo asking for a joint state and county run distribution site here, which we're now working hopefully to see a result on as soon as possible. Looking at the numbers by the key metrics, total cases since the beginning of the pandemic now at 10,635, total tests at 273,000 plus, 8,845 recovered, and for the first time in several months, thank God, we have not had any additional fatalities since my last update on Thursday, so we are at 227 now. Of course, the country memorialized a very grim milestone yesterday of over now 500,000 Americans lost to COVID, and we've had our share here in the county, and we'll do everything we can to get that number down to zero more as soon as we possibly can. But that is an encouraging sign that we're starting to see those losses slow down, especially in the last week. Hospitalizations correspondingly are also significantly down. Another good sign, we're at 7 currently hospitalized, none in the ICU, and you can see a very clear trend. Was just speaking earlier today with Dr. Doyle at Health Alliance, and he reaffirmed that they're very encouraged by seeing the hospitalization numbers really coming down, so that is good news. Our active case rate also down and continuing to decline in the right direction. We're at 1,563 active cases in the county. That's the lowest that we've been since the very beginning of December, really before we saw the bulk of this second wave hit and the post-Thanksgiving hit. So we're not through it yet, but to see us largely clearly over the peak of the second wave and now on the downslope is very good news. Looking at the new positive infection rate, this is also a key metric, if not the key metric, and we're finally seeing this consistently tick down as well. In the last 96 hours, the county's new infection rate has been 3.53%. Again, we were up at or over 10% for quite a while, and to now be well under 5 and slowly working our way down towards 0 or at least below 1 like we were in the summer. That is the continued goal. So once again, the county at a 3.53% new positive rate. That came from testing 4,588 residents, 4,588 in the last 4 days, and having 162 positives out of those tested. Finally, looking at the long-term cumulative projection, once again, this is just really to showcase that depending on what each of us do and how effective our measures are, how seriously we continue to take the spread of COVID, even as we see the numbers come down, that has a huge impact looking forward in how serious the infection rates are. And you can see that here with the best, most likely, and worst case. And we are now finally on a trajectory where the best case is within our reach. So that is good. Hospital capacity forward-looking, also in good shape. Once again, you can see the current number at 7 and much more capacity than is needed in the near and medium and long term. As always, with all that reason for optimism and encouragement, we also have to have a healthy dose of humility, because the virus continues to do what viruses do and to have a say in this. And so it is critical that as we continue to try to bring those numbers down, we keep our guard up. We continue to ourselves and with our families and with friends and gatherings and work, if you're at work in person, that we're wearing masks, that we're maintaining distance and avoiding gatherings and social gatherings, and that we're continuing to wash hands. All of those we now know are proven by the science, validated by all the health experts, and still very much a critical tool in the toolkit to control the spread of COVID and ultimately save lives, so that we don't have a month like we had in January and the beginning of February ever again in any of our lifetimes, God willing. Switching gears to our vaccine allocation efforts, I'm going to talk a little bit about that, and at the end share some of the numbers in terms of total progress. The good news up front, at least relatively good news, is that our allocation for vaccines in the county this week is up from last week. So that is, we'll take anything more. We need a whole lot more, but at least to see some increase. We were allocated 1,900 doses, 1,900 doses for this week. That is in addition to 1,500 doses from last week, which were actually delayed due to the national weather disruption. So we actually have basically 2 weeks worth of vaccine supply, which we'll be administering this week in the county. And just as a point of reference, the increase from last week to this week is a 26.7% increase. So it is a positive sign that we are getting more, and that every community across the country that's struggling with shortage of supply is getting more. How will those doses be allocated this week? Here's the breakdown by category. The 1A, which are healthcare workers, 300 doses. Those will be directly administered by providers and hospitals. 1B, which are our frontline workers, first responders, teachers, and so on. There are 700 doses to be allocated. Those will be distributed at our county sites. And then for seniors, 900 doses. The preponderance of those this week are actually not going to the pharmacies, but are going to our federally qualified health centers. I'll put that list up here in a second. This is a frustration, I know, of mine and many, that each week the allocation is changing. That is a determination made by the state. We've asked them and others to try to make this more regular and predictable, so that at least folks know if one place has it 1 week, they're likely to have it again the next week. But given the limited supply and the effort to be fair in how it's being distributed, that means that for right now, each week this will change, and I and we will do our best to communicate that so that everybody knows what's going on in that regard. And then once again, just as a reminder, logistically, those 1,500 doses we were allocated last week started to arrive early this week. Some of them are being distributed now. The rest will be distributed in addition to this week's allocation. Here is the site of health centers and pharmacies that are getting doses from this week's 1,900 dose allocation. I won't read these through. You can see them right on your screen. These are all federally qualified health centers, meaning they're designated by the federal government as providers or health centers particularly focused on serving underserved communities in the county or in the area. So this is an important effort and commitment to make sure that as we get more supply, and with whatever supply we have, that we're making sure that all members of our community, especially those that often have trouble accessing our healthcare system, are able to get access to this critical vaccine. So that means that this week there are not doses flowing to CVS or Rite Aid or Walgreens, although it's possible that they have some left over. And again, it's possible that could change next week. I know that that's frustrating and not ideal, but that's the situation that we have right now anyway until supply picks up. I'm going to put up some metrics in a second in terms of our Ulster County vaccine progress numbers. But before I say that, I want to be very clear, and I've heard from many of you, probably hearing from you now in the comments section as well. I am painfully aware that we don't have nearly enough vaccine right now for residents of the county that are eligible. We have 120,000 people eligible, and we continue to get somewhere between 1,000 and 2,000 doses. So about 1% of that in terms of supply each week is what we're getting. That means a lot of frustration and disappointment for those that are eligible on paper, but not able to find an appointment either in the county or even in other parts of the state, going as far as the Canadian border. I have and will continue to advocate that at a minimum in Ulster County, we have to make sure we're getting our fair and equitable share of whatever supply is happening at the state level. So last week, I did send a letter to the governor asking and following up really on his offer to stand up joint state and county-run vaccination sites, which would give us more state resources and hopefully more supply. I am working and in conversation with their team about that. I'm hopeful that we'll be able to get that up and running as soon as possible. And in the meantime, I'm encouraged that we did get some additional vaccine allocation this week, and hopefully more to come in the coming days and weeks. I do want to share some numbers. The state has now stood up a statewide vaccination progress dashboard. So if you are interested to see how Ulster County compares to our neighbors in the region or even around the state, you can actually go on that state page. Here are the numbers from Ulster County specifically. And, we have a ways to go, but I do think these are encouraging numbers that we're starting to see real progress in terms of how many people we're getting vaccinated. So you can see 10,872 have gotten both their first dose and their second dose. And these are residents of Ulster County. So anyone whose home of record is listed as Ulster County. 10,872 with both doses, well over 20,000 with at least their first dose. So that is good news. And what that essentially equals out to is just over 11.6% of our county's residents have now received at least their first dose. So again, we have a long way to go. I will keep pushing and advocating and doing whatever I can to get us more. But we are making progress. That 11.6% number is slightly below the state average. The state average is 12.3%. As I've said, I think part of that is because we don't have a state-run site here. If you look at Westchester County, for example, or Albany County, where they do have those sites, we are seeing a higher percentage of their population being vaccinated, which makes sense. So that's why that call for a joint state and county site here is so urgent, and I'll continue to advocate for that. And I am optimistic that as soon as possible we'll get that going. What can each of you do in the meantime to make sure that with the limited supply that at least you and your loved ones are in line and pre-registered? The simple answer is that make sure, if you haven't already, you go to our Ulster County pre-registration list. That is at vaccinateulster.com. and I'll give you the phone number in a moment if you're not able to get online, which I understand some are not for many reasons. Signing up on that list means that you've put your name on there and your information. We have that. You'll get a confirmation from us. We are sending overall updates a few times a week or sometimes once, maybe twice a week when we have significant news. Just because you haven't heard anything doesn't mean you're missing something. It just means we just don't have enough supply, unfortunately, and so we don't have enough appointments. But as long as you're pre-registered, you're doing everything you can, and we're doing everything we can to get the supply up, and we're all going to just work to get through this and get this done as quickly as we possibly can and fairly as we do it. If you are not able to get online or have a loved one help you with that, you can call a recovery service center. That number is 845-443-8888. Also, if you're a senior and want additional help from our Office for the Aging, you can call 845-340-3456, 340-3456. That's for any seniors. The other thing that I'll ask, and as we wrap up here, we are getting a huge amount, rightly so, of calls, emails, Facebook messages, tweets, any form you can think of, as people are concerned and have lots of questions. So to meet that moment and make sure we're answering as many as we possibly can, I'm going to host, along with a few others, a vaccine and COVID, but probably I expect most of the questions will be about vaccine town hall. So on Thursday evening, in place of our normal briefing like this, where I'm mostly talking at you, we'll actually have a town hall format. It'll be both available on Radio Kingston, if you don't have internet or Facebook, as well as Facebook Live, if you prefer that mode. We'll also be doing live interpretation into Spanish language. And that'll all be on Facebook as well, in order to make sure that any questions that are related to the vaccine itself or health questions for providers or experts in terms of infectious disease and so on. I'm really pleased and thankful that we have Dr. Mark Tack as well as Marta Sanchez, who are going to join us. And in addition, Pastor Jim Childs, is joining us, who's a member of our Vaccine Distribution Coalition, to talk about some of the work we've been doing in the community to get the vaccine out equitably, especially to communities of color and underserved communities throughout the county. And that is something that I'm really proud of our efforts, and that will continue to work. So please spread the word. If you're online right now, please share that information. That event for that town hall. Would love to have as many questions as we can. That'll be Thursday night, February 25th. Can't believe it's already the end of February. That'll be Thursday night, February 25th, from 5:30 p.m. to 6:30 p.m. And again, that'll be in place of essentially this update. So if you're used to tuning in at 3 p.m. And you're able to set the clock back to 5:30, please do that. And we'll put up a reminder about that as we get closer to Thursday evening as well. As always, thanks to Radio Kingston and our translation and interpretation team for making that happen, along with all these broadcasts we've been doing. Thanks to the members of our Vaccine Coalition that are going to join in advance, and we'll thank them again when we do that event live. Thank you to each of you. Thank you to our frontline workers who I was just over at Health Alliance on Broadway today. Thank you to our healthcare workers there, continuing to treat COVID patients and all sorts of other critical healthcare needs at great risk to themselves. And all of our folks out there. We're doing everything that we can to keep you safe and healthy, and to get these vaccines out as quickly as we possibly can. Once again, in terms of next chance to hear what's going on, Thursday night, 5:30 p.m. will be our vaccine town hall. In the meantime, anything you need, you can call our recovery service center. We'll put that number up at the end. And that's not just exclusive to COVID, but I know and continue to hear stories of so many folks that are still struggling with food, still struggling with the threat of eviction or the reality of being forced out against those eviction restrictions, the need for mental health services, the need for addiction and substance use disorder services, and so much more. You can call our Recovery Service Center for yourself or your loved one or anyone that needs help. That's 443-8888. We are here to do everything we possibly can to meet the moment and help. On that note, we'll wrap up. I look forward to seeing everybody in a slightly different format and a more conversational town hall format, although I wish we could all get together in person, but soon enough we'll be able to do that. And in the meantime, stay safe and be healthy and stay resilient, and we'll see you on Thursday evening.